For this week's Starting Line, I'm Sarah Allen. The Centers for Disease Control and Prevention says vaccines can help prevent diseases and save lives, yet some parents choose to not have their child vaccinated due to health, religious, or other reasons. Representative Mike Freiberg, a DFLer from Golden Valley, wants parents to first talk to doctors before opting out of having their child vaccinated. He sponsors House File 393 that would require doctors to inform parents about the risks and benefits of vaccines before parents determine what they think is best for their child. Representative Freiberg, thank you for joining us to talk to us about your bill. Why would you say it's needed?
Sure. Minnesota is one of about 20 states that have a broad philosophical exemption to the vaccination requirements. So basically anything you believe, anything you've read that concerns you, whether it's true or not, is sufficient grounds for you to not vaccinate your children. And I have some concerns for that, partly as a parent myself. I remember bringing my 6-month-old child at the time to daycare, and when the children are less than a year old, they're not able to get all of their vaccinations. So they depend on as many kids and adults around them being vaccinated as well to ensure they don't catch vaccine preventable diseases. So this bill doesn't actually get rid of the exemption. It just says that if you choose not to vaccinate your children, you have to meet with a doctor or a nurse before doing so. Some other states have followed this approach, like the state of Washington. It had a similar exemption and very high exemption rates, and it was beginning to see outbreaks of vaccine preventable diseases. So the state of Washington adopted a law much like this one, and as a result it has seen immunization rates go up and the outbreaks of vaccine preventable diseases going down.
Did any groups or organizations work with you to draft this legislation?
I've been working with a group called the Immunization Action Coalition. They're actually a national group, but they do happen to be based out of St. Paul. So there are some people who used to work for the Minnesota Department of Health in their immunization unit, and they sort of gave me, I went to them, said I was concerned about this issue, and they suggested this approach to it and said that it had been used successfully in other states.
What type of support or pushback have you received or do you expect to receive about your bill?
Well, the bill has bipartisan support both in the House and the Senate. Very happy Representative Uglum signed on to the bill, so he's somebody who believes in public health measures like this, as I do. The governor, I spoke to the governor about this bill. He supports it as well, as does his health commissioner, Ed Ellinger, Dr. Ellinger. So there is and I have about 10 or 15 co-authors at this point. So there is strong support for it. I think I introduced it last year, and it was a little quieter that year, but I didn't get a hearing last year, but this year I wanted to reintroduce it. And I think with some of the recent measles outbreaks, there's a lot more attention being paid to this issue. So there are a lot of people who support it. Certainly there are people who have concerns about it as well, and I've heard from them. But I'm hopeful that the support, that more people will recognize the need for this.
Your bill was referred to the House Health and Human Services Reform Committee. Do you think it will receive a hearing this session?
I certainly hope so. I've spoken to the chair a couple of times. She hasn't promised me that she will, but as I mentioned, it's a bill with bipartisan support. I'm hopeful that will help create some pressure to have a hearing on it, and hopefully there won't be any more outbreaks or anything. I certainly don't want that to happen, but I think certainly with the measles outbreak at Disneyland, just issues like that being in the news, I hope that'll create some pressure for there to be a hearing.
Coming up next week, we will feature a new bill on Starting Line and look to see if there's any updates on Representative Freiberg's bill. And remember, hundreds of bills get introduced every legislative session in Minnesota. All of them first have to cross the starting line.